Welcome to this technical dialogue, the first one of the expanded consultation on technical assistance and health supply chains. The topic for today will be how gender, interculturality, and ICT4 development may influence the design and delivery of technical assistance, especially at subnational and community levels. I have the pleasure to introduce our speakers. Dr. Revi Sterling, she's the director of USAID's Women Connect Challenge, and also a passionate ICT4 development expert. Dr. Wuleta Lemma, who's the founder and CEO of Lalibela Networks in Ethiopia, Lalibela Global in the US, that, by the way, has been recently awarded by the Jack Ma Foundation as one of the 20 top Africa business heroes. Congratulations, Wuleta. She's also an honorary associate professor and director of the Center for Digital Health and Artificial Intelligence at Wolo University in Ethiopia. And Dr. Nora Muntañola Thornberg, who is an anthropologist with ample experience with indigenous communities in Mexico and with migrant communities both in the US and in Europe. She is the director of Gender and Interculturality at Janus Global Consulting, and a lecturer at the Open University of Catalonia in Barcelona, Spain. So welcome, Revi, Wuleta, Nora. It's a pleasure to have you here. And to start our dialogue and our conversation, I would like to invite Wuleta to start sharing with us some of her experience in developing capacity in the areas of global health and in the areas of technology. Wuleta, all yours.
I have been thinking about capacity building for some time. I've been honored to do capacity building at the international level, but also to up to community level. And in Ethiopia and in other places, but I can talk about Ethiopia. And there are positive things in capacity building as a TA from our side, supporting ministries of health or other ministries, education and others. And then there is a different kind of capacity building that is needed at a community subnational level. And I think sometimes there is a disjoint between it. So I spend my time trying to develop capacity of healthcare workers that can work at a provincial level or at a national level. And then I spend my time working with healthcare workers at a community level. Young people, building their capacity so that they can work in their own district, in their own area. And I think sometimes the problem, the community, or in this case, districts or below, they know what is the problem, even the healthcare professionals. And sometimes we don't talk to them. We tell them this is how it should be done. And I feel sometimes the problem is managerial. It's not only technical, because some of these healthcare workers, they go to school and they are nurses or IT or whatever. They take the course, the IT course or the nursing course or the district health manager course. But when they are placed into a position, some of the things that they don't learn is the management, is the bottlenecks. The second part I learned is we do a lot of training, short-term training, a lot, thousands, and I have done it also. I realized that, okay, you can increase their awareness, but people want something that can change their position. Even a healthcare worker, a community health worker, doesn't want to be a community health worker forever. They need a career ladder. I have seen healthcare workers who are trained at a community level, health information technicians. We started the first in Ethiopia. Unless you create a career ladder, you can't expect somebody to work there 10 years, 15 years. Let the other young people come in and take the position. And we are slow we like them so much, we want them to be forever there. We wouldn't be forever there. So why do we expect them to be forever there? Why can't they grow? So when programs are designed, unless there is a career ladder, people don't care about the 1 week trainings, the per diems that we give. To be honest, what they prefer is you give them something that can help them. In America, we have continual education credit that we give for different healthcare workers. And then that credit can help you in your job to grow, or it can also help you with the nearest university around. So for all these years of experience, I believe management is very important. We don't spend money on the management and the bottleneck. And then I also feel we should expect them to grow. We cannot expect them to be there 10 years, 15 years. I've met people who tell me 15 years, 20 years. And then what do? They find a better job in the other Middle Eastern countries, and they just go for a lesser job because there is at least they get more money there.
Very important points, Wuleta. It talks a lot about actually having a dialogue at the subnational levels and really caring for what people think and their experience, and then using that for reverse innovation. I mean, bringing that upwards instead of always, being a top-down approach. The issue of management, and we do a lot of investment in technology, but we don't really do a lot of innovation management. We don't teach people how to select the type of innovation that is needed, the reasons why it's needed, the upgrade, distribution, the adaptation. Revi, in your experience, how are these things being seen in the work that you're doing, especially now? And you can tell us a little bit about Women Connect.
Sure. Hi, my name is Revi. I'm delighted to be here, and I just loved what Wuleta was saying. I'm just like, yes, of course. And yeah, this is, it's so good to hear these perspectives from somebody besides yourself, because I think in a lot of times, especially in Washington, D.C., where I am, it's a bit of an echo chamber. And you can say things like, well, the global digital development principles say develop with the end user and all this kind of stuff. And that doesn't matter. That has no teeth. What are we actually talking about? And what's been really important for me to focus on since for the last 5 years here with USAID and other implementing partners has been, really looking at the hyper-local solutions, the hyper-local information needs, the gaps, but mostly, the gender and social norms that keep women offline. Because you have so many people in the community that, unlike us in development, who don't want to have empowered women. Empowered women are terrifying. They challenge the status quo. And yet these are the ones that we say, oh, well, the women will be the community health workers, and they're in charge of the health and education of the family, so we'll just make an app for them. And you have this amazing disconnect, especially in ICT for development, of everybody wanting to design for the last mile, for the woman, for the girl child, for all this, and then yes, they're aware there's a gap, but they have no idea how deep that gap is, and that it cannot be addressed by a technology. It can only be addressed by a cultural and societal intervention. And that's where I've been really focusing the last several years, is looking at these interventions that are very based on these social norms of how terrifying it is to have empowered women, especially empowered with internet technology. All over the world. And of course, some of the restrictive communities where we work, you have members of the faith, clerics, imams, pastors, etc., saying that, the internet is immoral for women. You've got husbands that say, husbands and mother-in-laws, and, different cultural factors in different communities who say, my wife or daughter-in-law or daughter is too dumb to use the internet. She'll just bring shame on the family. There's a lot of taking this online gender-based violence agenda, which is a significant problem, but conscripting it and bringing it over to reasons why women shouldn't be online. And I'm watching that dynamic happen right now, and watching while large development agencies and funders say, well, we're not going to put in internet in these girls' schools now because we're afraid they're going to be harassed. And they're harassed in real life, and in at least online life, we can do things at the hardware level, the middleware, the software level, the end user level, and we can help build their confidence so they can just they can delete that message, and it might actually have some implications on real life. So I think there's just, every year has been a worse year for women in technology. We have fewer and fewer women that come online. And those are the women that need development information the most. And I think this populist regression, thing that's happening globally is really playing out, on women and information needs, even though every year I get the GSMA report and all sorts of other rosy reports that, the women in phones, that's the answer. So if you're a high-tech company, if you're a donor agency that doesn't know better, sure, send women phones. I would like to know where all these women in smartphones are, because I've been looking for them for, well, not smartphones for 25 years, but I've been looking for women with phones for 25 years. I've seen many, we all have, and yet I see more who don't have. And if they do have it, they don't know how to use them. And if they do have it, they use it more as a flashlight than anything else. Pardon me. Or they buy, they get the hand-me-down phone with the cracked screen, and it might be a smartphone, but it's a first-generation smartphone, and it's never going to run the diagnostic apps or the supply chain apps or anything that we keep creating. So I do think that we have a huge creation, design, reality gap. It's been talked about forever. I would have said 5 years ago I wasn't optimistic, but I'm going to leave it on this optimistic note. Well, I would say even 5-10 years ago, when Arlette and I first started working together, 15 years ago, whatever, if a woman didn't have access to, technology or the internet, okay, she was missing some stuff, but she was still able to take advantage of things like health and development, education things. Extension workers would come to the village or the community, and the woman would be able to meet with them. I mean, there are gender dynamics there at play, obviously, but that information was not necessarily closed to women. Now, with everybody, DFID, USAID, World Bank, everybody having these huge encompassing digital strategies where all the development sectors are moving towards digital, now we are introducing a crisis of our own making by making that content now completely out of the realm of women. And I'm going back to different agencies and donor companies now and saying, I know the last thing you want to do is create a gender digital divide, but you are. And given the amount of money and focus they have in this, there is sort of an awakening that, oh, that's a problem, isn't it? I'm like, yeah, now it really is a problem. In the past, they couldn't check email. Now they can't get the vaccination schedules. Now they don't know that quarantine means their kid can't go to school. So now we really have to address this gender digital divide. And that's really what I've been focusing on are, again, those social norms at that very local level that would even enable women, and find the circumstances in which they would be able to use technology. So for me, that's where the capacity building really lays.
That is incredibly interesting, Revi, because really what we hear the most is how the access to technology empowers women. And when we think about the workforce, whether it's the health workforce and whether it's the supply chain workforce, gender plays an incredible importance on the access to education and the access to training. And if everything is starting to be digitalized, and it's not just an issue of access, it's an issue of learning how to use, and how much a gender perspective is really taken into consideration in designing all the technical assistance structures, and instead of just saying, well, we're just going to go online training. And but Nora, I see that you have been following quite a
yeah, I'm very excited. No, it's great to participate in this conversation, but I totally agree with what Revi and Wuleta and yourself, Arlette, you all have been saying. Just one thing that really for me is important, and Wuleta said it one way or another, that is local knowledge. You know how we anthropologists are in general. And you said something that is very important, but you didn't mention the word respect. That I think is what many people in community, level in general, they really they need to feel that. And this is something that is always there sometimes with people, with you all, I'm sure, and with other people, but sometimes it's missing, it's completely missing. Respect, not only for their local knowledge, also how to be able to create, a situated knowledge. That means that we all are together and we can share different platforms. And what was very important and very, successful, I think, in the late 90s or the beginning of this century, was that many women in indigenous communities, that's my field. I have been working in Mexico, as Arleti said, in community clinics, in a small primary schools, but very, very little with the Chontales. They really, when the first cell phones or even the first smartphones arrived, really women felt that they had this new community, and they really felt that the virtual campus was a community for them. And there was a sense of freedom and how to deal with their own languages, that they didn't have materials in their own languages. That it's more or less, it's not the same, but like in Ethiopia, in Mexico, you have all these different languages, that it's a lot, more than 100 or at least 70. And then they have problems how to communicate, how to translate orality into, their way to be able to improve with their lives and to be more efficient. So if we are dealing with capacity building, the women felt at that time that they had new tools and they knew how to use them. But they didn't know how, obviously, management, that you said it, Wuleta, and it was very, very important. And then, as Revi was mentioning, also the hierarchical systems, because that is related to the social rules, but also to the way women themselves feel their own place in their communities. But at the same time, I agree that people are bored to death with all the things that are related to instruction at the workshops. They don't like that. They want to learn by doing things, and they want to learn by their personal experience. I have been teaching online courses. I have to say that the only way for me to be able to see all the changes was to be very flexible and to let the students be the center, to let them really use the networking. And at least for me, indigenous people in many places know how to do networking better than the way we do. They are great in that. So let's learn from their ways to use their memory, the ways they know how to deal with problems. They are much better and much creative and innovative than the way we are. So I think there is completely disequilibrium. It's not balanced because we have this local knowledge that is powerful. We have these people that really want to be good workers. They want to be efficient and capable. And at the same time, we have these other people that want to teach them, and it's okay. And it's, there are different layers and different levels, but there is no intercommunication. And for us, for anthropologists, that's, if there is no exchange, there is no kinship system that will work.
Actually quite interesting, because I think that what you bring, Nora, is that communities exist, and they have existed long before technologies. And when we bring these technological solutions, we don't focus about building that community and strengthening that community and learning from that community. We actually bring in solutions. And without paying attention to what are you really addressing when you bring that solution, and how much are you being disruptive in a positive way, or how much are you being disrupted in a very negative way, where we're actually leaving the community weaker in their response than what they used to be before the technology was introduced. As we gather to the end of this conversation, I'd like to ask our panelists to focus a little bit on the topic of this consultation, which is developing capacity at the subnational level. Wuleta, let's start with you. What would you recommend?
So I moved from the NGO sector to a private sector. Why did I move from, why did I start a private sector company that works in Africa, in this case, in Ethiopia. I wanted to bring solution, but hearing it like Nora said, the problem from the people. They, instead of bringing a solution that may work in the US or Canada or wherever, so how can we do better capacity building? I spent my many years starting from the problem from them, and then identifying healthcare workers, in most cases women, because at the lower part of the healthcare system is mostly managed by women, and understanding how to help them to solve that problem technologically. Not only to solve it, but also how to make it easier for you. Technology cannot be a burden. It has to solve a problem that you have. It has to be to solve her problem. So I spent time trying to build the capacity of young women, in my case, who are working in the healthcare system, in information, in the data room, in the card room, which is, really in many places a horrible place to work. You may get asthma or whatever because of the paper and the situation. So I tried to design a course that can empower those young women so that they have some kind of associate degree to solve the problem where they are working. So most of the first batch that joined the trainings that we did came from them actually, and then they got a degree. So I believe to also align it with local universities. I don't think it can be parachuted at a local level from outside. It has to be working with the local universities and make sure that they also design a program that can solve the local problem. So I think involving the private sector, and in Africa, the youth, there's so much unemployed youth, especially young women down there. If we can create jobs, but so that they can also make money, but also do social impact. I think if we think it for supply chain, for all of these things, I think that is very important.
There's a learning curve to listen, first of all, what the local situation is and what the solutions are being brought to the plate, and and the gaps that you need to address. Also taking into consideration them in the design of the learning and the design of the technical assistance and the empowerment really of the health workforce. Revi, what is your take on this?
I've really loved listening to Wuleta and Nora, especially. I mean, this is why we always say we need the social scientists, the anthropologists at the table, and then people don't know where one is. If you don't have a Nora at the table, don't go do a community technology. I mean, it's just pure and simple. If you're not co-designing and building some dignity in the design, why would anyone ever use it? And I think that that the point's being made that these communities existed long before technology, and the technology has to augment and complement what is already there. It cannot rip and replace. That's a huge disrespect. That's just coming in and plowing over, a culture. So love hearing these points. I do think that, Wuleta's discussion about, tech training and the opportunities is so key, because tech does need to train people ongoing. People move, people change, people forget. I mean, all these tech trainings that even I've done where I'm like, I know we only remember 10% of this, and we just threw this much at them in 3 days, and wow. So why we need to build smarter tech? And I think a lot of things in tech for development, we focus on dumbing down the technology, making it more simple, which is just the counterintuitive way to do it. When you're doing computing for the margins, the marginalized, it pushes the margins of computer science. I mean, we need technology that sort of says, you seem to be stuck. The technology needs to be nicer to the users that are going to use it, as opposed to, technology shouldn't change people. The people should be able to rely on the technology to make their life better. I also think that on the backside of this, there's a lot about reliability. If you're focusing entirely, if your payments, your micro payments for your things are done on digital financial services, and you're using platforms to help with supply chain, and you're in a country that shuts down its internet all the time, for civil unrest or rumors or elections. You are messing with livelihoods in the biggest way. And you're telling people, please depend on this. This is your this is your lifeblood. And then you have governments that, whose regulatory, boards turn things on and off. It's very disjointed. It creates more distrust in the technology, as I've seen with some of the communities I've been working with, mostly in northern India. So we need smarter tech. We need regulators that understand that if you're going to push an entire community to be more digital, that it has to be something that's a benefit to them, and they have to have a workaround for if they are going to turn things off. Is it a local intranet? Is it something? I also think that, it plays into, technology can be a big tax if we're not totally smart about this. Look at all this artificial intelligence push. What's an AI for Africa? What is the AI for development? AI is very extractive. It's an extractive industry. We data scrape, we data mine. These are not communities that need us taking more. What do we do in this space around conversations to say, how is this augmentative and a benefit rather than just an extraction? Because then I think we get back to that dignity and respect piece that Nora brought up. So I think there's a lot to do with tech reliability. There's a lot of bringing the technology to people and having them co-design, and this is hard and it's expensive and it doesn't scale necessarily well. If you have a community where a frog is a symbol of something, but 20 kilometers away, that frog is not loaded with that kind of symbolism, but something else. It's hard for me to go back to a donor and say, we have to do this really very specific project. But could the technology let you pick your own symbol to use? So there's ways we have to have conversations where it's not scale versus impact, but what can the impact do? What can be the impact if technology was actually smarter and engaged people more? Then we could scale.
That's great, Revi. So Nora, with COVID-19, everybody has jumped into the bandwagon of online learning. And this probably is a trend that won't be reverted. In your 20 years of experience teaching online, what are some of the lessons learned that you could share with us?
My 20 years of online teaching, we went through 3 major phases. The first one was when we were learning how to use new technologies, teachers and students, and we were very excited about it. At that time, teachers were focused on content and the new technologies, the virtual campus, and students were focused on learning and competencies. Then we went to the second phase, and the second phase moved the focus on the students, and the students were placed at the center of the virtual campus. And teachers were not as worried about content, more about the learning aspect of it, and students were more focused on process. So after this phase, we went to the third one, and the third one, that is the one we are now in, focus on learning by doing. And it's a major change because social interaction is the core of the learning and teaching experience. So this time is the time of collective knowledge, of self-responsibility, and of switching roles. So teachers are mediators and facilitators, and students at the center are self-responsible, collaborative, and they are also teachers and students, both roles. So after the COVID-19 pandemic experience, we know that all these phases will go fast, really fast. So we have to take under consideration all the changes, and we have to focus on communication, exchange, integration, inclusion, and how to deal with all these aspects that normally they are not at the core of class and online class design, but we have to be sensitive and careful and take under consideration all these issues. So how we can make class design gender focused and inclusive? We have to first take under control several issues that many people do not think about it. Like, for example, language. Language has to be center focused and has to be inclusive. And we have to learn, I mean teachers or designers and also students, but mostly teachers, we have to learn how to realize the way women learn. Also take under consideration the difficulties that they have to access education. We have also to open the doors and make the learning process accessible, flexible. Then for women will be a safe place, and at the same time a place where they can be creative, they can learn how to be managers, they can improve their working skills, they can do many things, but feeling that this is a space that protects them, respects them, and make new possibilities and innovation a reality. And many of them, they don't feel, they don't perceive that the virtual campus is something that they can belong, that belongs to them. They don't feel that way. So we have to make that clear. After that, the other thing that is important is that the virtual universe should not be the universe or the cosmovision of the teacher. Should be an addition of different cosmovisions and different ways of telling lives. You know, people from communities, technicians, workers, they have their own way of dealing with their stories. They have their own way of understanding their own history, personal histories, families, kinship, stories in general. So they should be able to feel that there is a space for them in this virtual community. And all these issues that maybe are not taken under consideration at the beginning, we should make sure that they will be there when we begin designing an online class. We have to make sure of that. And that is very easy to say, but it's not that easy to do. So this is my major recommendation.
This concludes our first technical discussion to complement our expanded consultation on technical assistance and health supply chain. I hope it opens the door to enrich our discussions with how gender, interculturality, and development perspectives influence and help in the design of technical assistance and the delivery at subnational levels and at community levels. I look forward to your comments.